I've wanted to do Operation Walk Chicago for a long time and haven't had a chance to go for a variety of reasons. This is my first trip here, and I'll be honest, I've loved it. It's been amazing. It's been amazing to take care of these patients. It's been amazing to kind of do surgery using things that we have and not all the things that we have at home, but sort of being a little bit more challenged in terms of having equipment and being able to work through that. We do a lot of hip replacements in the US, as well as obviously a lot of hip replacements are being done kind of internationally. My sort of perception of the difference in terms of the patient population here relative to the patient population back home, number one, I think, is just the relative access to care. There's a huge population of patients here that live in communities where they don't really have as much access to care, and so although they may be diagnosed with hip pain or hip osteoarthritis or hip avascular necrosis, treatment for that isn't as easy to find. I think that we've noticed that patients that are getting the surgeries done here post-operatively, I think they're a little more accepting of the post-operative pain that they may have, and they're, I think, significantly more willing to kind of participate in physical therapy. The other interesting thing that actually was brought up earlier was that when therapy is done here, it's a much more communal feeling to physical therapy. So the patients themselves are motivating each other to kind of walk and climb stairs and do exercises, which is also fairly unique relative to kind of the practice at home, which again is more individualized. It's more personalized and individualized like back home. So I think we've done a great job with these patients. I think the team is amazing. I think what I've been impressed by is it's not just surgery, so it's not just simply do a hip replacement, but beyond the hip replacement, there's the preoperative care that these patients are getting and the optimization they're getting from the medical viewpoint, from the physical therapy viewpoint, and then the post-op care. I mean, this facility is great, and they've been helping take care of these patients wonderfully. So I'm looking forward to doing it again, but this is really a great first trip. How is pain on that side?
Cái độ đau bên đó thì sao?
Này không có đau, này chỉ khó đau được không?
So that side good, this side a little bit, and this side.
It's going to be great, okay? As you stay walking, keep exercising, both of your hips are going to end up feeling really good.
Hôm đó là anh cứ tiếp tục tập luyện, đi nhiều lần đấy thì nó sẽ từ từ nó sẽ tốt hơn, và nó khỏe hơn.
Any questions?
Có câu hỏi gì không?
No? Okay. All right. Here, okay.